Hello and welcome to Integrative Process Psychotherapy, a human way of understanding what we do as therapists. In this video, we're going to explore one of the most fundamental aspects of psychotherapy, therapeutic presence. Over the years, psychotherapy has developed an enormous range of theories, models, and techniques. These are valuable and they give us structure and a language to communicate with each other. But if you ask clients what really makes a difference, they rarely talk about technique. They'll tell you about feeling understood, feeling met, feeling that someone was truly there with them. So this raises an important question. What is it that the therapist brings into the room that makes therapy come alive? The answer, more often than not, is presence. If you reflect on your own clinical work, you'll likely notice a consistent pattern. Some sessions feel alive, connected, meaningful, vibrant. There's a natural flow. You're not working hard to make something happen. It just unfolds. Other sessions feel effortful, flat, disconnected, even boring. And you can find yourself being distracted, thinking too much, or searching for interventions. And all the time you're wondering, oh, what am I missing? The difference is not usually the client, and it's not usually the theory you're bringing to the session. Very often it's the quality of presence in the room. When presence is strong, therapy becomes a living process. When presence is weak, therapy becomes mechanical and dry. What is presence? Presence is difficult to define precisely, but we do know when it is there or not there. It's the capacity to be fully attentive, emotionally available, grounded in oneself, and genuinely engaged with the other person. When we are present, we're not preoccupied with performance, and we're not lost in technique, and we're not trying to control the outcome. We are simply there with the client, moment by moment. And importantly, presence is a powerful experience. Clients sense it directly. They know when we are truly with them or when a part of us is somewhere missing. And if we're not there, some clients will feel abandoned and very unsettled. Presence begins with a simple but demanding requirement. We must be in the present moment. This sounds obvious, but it's surprisingly difficult. For example, many clients are pulled out of the present moment into the past through regret, loss, trauma, longing, or maybe they're drawn into the future through anxiety, fear, anticipation, an expectation that something has to happen. For example, a client might say, I used to be so confident and social, and I don't know what happened to me. In that moment, there's a strong invitation to you to follow them into the past, to question, analyze, explain. But if you do that, something important is missing. In contrast, a present-oriented intervention might be, I can see how much you wish to be that person you were. But as you talk about that time, what do you notice right now? That question directs their attention to the present moment experience, not a story lost in time. One of the key shifts in working with presence is moving from content to process. Content is the story. Process is what is happening right now. So we could ask ourselves, how is the client conveying what they say through words, intonation, and tone of voice? What do I sense they are feeling? And how am I responding to that feeling? And what is the quality of our connection? It's not uncommon for certain intellectual clients to talk calmly and rationally about an event that is very painful. Paying close attention, you notice their face and body looks tense, their voice is unexpressive, and you feel slightly disengaged from whatever they're saying. So you might make a comment. This seems like a very painful experience, but I notice you don't seem upset. And I wonder what's going on. Now the work moves into the living moment. Presence is not something we achieve once and for all and can maintain for long periods. It comes and goes, and we have to keep bringing ourselves back into the present constantly. In some therapy sessions, it's easy to find ourselves drifting, getting distracted, losing connection. And when we notice this is happening, it's really a time to pull ourselves back into the moment, to make that effort to return to the here and now. That movement, losing ourselves and returning to ourselves, is not a failure. It's the practice of presence. Presence begins with embodiment. The body is not just a container, it's a source of information, profound information. Through the body, we register tension, emotions, relational shifts. Again, you're sitting with a client who's just described an incident of sexual molestation when they were 5 years old. You notice your breathing is a little shallow. Your body feels slightly odd. And it's hard to hear what is being described. Now we know from countertransference that this may reflect the client's own disconnection and dissociation. If you ignore your experience, both of you might avoid or drift further away from this important subject. In contrast, if you ground yourself, feel your body, check in with your breath, you may be able to say, "This is so hard to hear. I notice myself getting drifty. I wonder what you're experiencing in your body." This comment can bring both of you back into real connection in the present. Presence of heart is compassion in action. It's the capacity to care, to connect, and to remain emotionally available, but it requires balance. Too much closeness and we may get overwhelmed. Too much distance and we will detach emotionally. Always we have to balance compassion and empathy with a clear sense of our own boundaries and our own experience. For instance, a client is sobbing, grieving the death of her child. She says, "I should be over this by now, but I keep crying every single day and I can't stop." Presence of heart responds not with a correction, but with a connection. You think you should be able to put it behind you and move on, but still in this moment, you're devastated and profoundly sad. This invites a gentle contact with reality without judgment. Sometimes compassion also requires caring confrontation. You might say, "Something in you is struggling to face this reality, and you keep getting stuck." True compassion always serves growth, not just comfort. Presence of mind is clear, curious, and aware. It involves noticing patterns, holding complexity, tolerating uncertainty, making connections between this and that. Many clients repeatedly form relationships with critical and abusive partners. We know this, we've seen it many times. They tend to blame the circumstances or the other person for the conflicts and the difficulties they are experiencing, but they're missing their own part in the drama. Instead of interpreting, you try to stay curious. I wonder why this pattern keeps repeating. What do you keep pulling yourself into? Can you know what's going on now? Presence of mind allows understanding to emerge over time rather than forcing insight. Insight is important in therapy, but unless a person changes what they do and their actions in the world, it's really not successful. So we focus on action, but not forced action. Presence of action means interventions arise naturally in the moment. Timing is attuned to what is happening for the person, and the whole self, both the client and yourself, are engaged in what's going on. So, for instance, the client avoids taking the next commitment step in a positive relationship. They're avoiding moving in together and they're holding back through fear. You sense this is a turning point and they need to make a decision one way or the other. You might say, this is really important. Maybe you don't feel ready to commit yet, but you do realize that not making a decision is a decision. That intervention carries weight because it comes from presence, not pressure. It invites the person to engage with what's going on with themselves now. Presence is not something the therapist creates alone. It is mutual. There has to be a resonance between the client and the therapist happening in that space of togetherness. At the beginning of therapy, clients can be guarded and hesitant. They're not sure exactly what they should do or whether they can trust you. So they keep themselves at a distance, and they may only tell certain things and leave out what is most important. But over time, as the relationship matures, moments of mutual presence occur more and more often. I can remember a timid, withdrawn client who really made eye contact and spoke in such a soft whisper I could hardly hear her. I would make funny comments, and in the beginning she wouldn't respond, and then finally she looked straight at me and she laughed out loud. And in that moment I could feel the connection between us deepen. It was a significant moment. It marked the beginning of a kind of mutual presence that we're together. This is what Martin Buber, the great Jewish philosopher, called the I-thou relationship. Two people meeting as human beings, not as roles. And in this space, the client is no longer just a problem to be solved. The therapist is no longer just an expert. There is a real relationship happening. Very occasionally, therapy moves into something more profound, harder to describe. Out of the blue, there's a sense of clarity, of expansion, of connection with something greater than just me and you. This can't be planned, and we can't do anything in particular to make it happen. It's as though a mysterious presence enters our shared space. These are transpersonal or numinous moments. They remind us that therapy is not only technical, it's not only about working with psychological problems, it's creative, it's relationship, and its meaning and purpose extends far beyond what we understand personally. So what does all of this mean for us as therapists? It means that our work is not only about understanding theory, applying techniques, it's about developing our capacity to be present, to bring our body, our heart, our mind, and our actions, and also our inner nature into alignment in each moment. Fundamentally, therapy is not something we do to clients. It's something we enter into with them. It's a living, unfolding relationship. And when presence is there, something real and unexpected can happen.